Bismillah ar-Rahman ar-Rahim. Today we talk about the important lectures under the title of a nutritional requirement and special situations. This lectures for the third medical class from the nutritional module. About the learning outcome. The student you should be able to at the end of these lectures, the first describe the food needs of a pregnant and a breastfeeding mothers during the lactations. The second, describe the nutrient requirement during the infancy and childhood, what's called the growing child. So, at the end of these lectures, all students you should able to know the needs, nutritional needs for the pregnant woman, lactating, and the infancy and childhood age group. Now, what about the nutrition? What about the importance of the nutrition during the pregnancy and lactation? An unborn child needs a healthy and well-nourished mother to grow properly. Therefore, a mother needs to gain weight during the pregnancy to help nourish her and growing baby. Women who do not gain enough weight often have babies that weigh too little, is called the low birth weight. When the birth weight less than 2.5 kg is called the low birth weight. This low birth weight is an increased risk of chance of both physical and mental health problem. Also, this is a low birth weight associated with an increased vulnerability for infections and malnourishment and compared to the babies of a normal weight. The birth weights are very important issues. What about the increase in nutrient during the pregnancy? What about the type of a nutrient which is increased during pregnancy? An increased requirement, for example, energy, protein, essential fatty acid, vitamin A, vitamin C, vitamin B, B1, B2, B3, B5, B6, B12, folate, calcium, phosphorus, iron, zinc, copper, and iodine. Women should gain at least 11 kilogram during all of the pregnancy. If the mother gain less than this, the baby's chance for survival and health declines. If a mother is overweight, she still need to gain for her baby's health. She should not try to lose weight while she is pregnant. What about the gaining weight during the pregnancy? What about the distributions of the weight which is gained during the pregnancy? Pregnant mother should gain weight smoothly and steadily. If the weight gain occurs suddenly, she should see a health professional immediately because of other differential diagnosis for sudden increment of the body weight during the pregnancy. During the first 3 months, she should expect to gain a total 1 to 2 kilogram. During the last 6 months, she needs to gain about 0.5 kilogram each week. If she has an already gained 11 kilogram after 6-7 months, she should continue to gain moderately until the delivery. Why? Because the baby puts most of its weight during the last few months. This figure showing the distributions of the weight increment during the pregnancy. 2 kilogram of the body changes from the breastfeeding, and 2 or 4 kilogram blood and fluids, and 2-3 of the kg of the placenta, and 3.3 kilogram the weight of baby, and 1 kilogram weight of the uterus. All these distributed and ultimately will lead to the gain of the weight during. Now, answer. 29 weeks pregnant woman, that is 7 months and 1 week, has already gained 12 kilogram of the weight. What would you advise her and why? The answer, even though the pregnant woman has gain 12 kilogram, which is a minimum required in being 11, you should advise her to continue to gain weight little by little until her baby is born. This is because the inborn baby put on most of its weight during the last month of the pregnancy. That's why the preterm baby having a lot of complications regarding the weight and regarding the nutritional deficiencies, which is resulted from the being born prematurely. What about the eating habit during the pregnancy? The followings are essential nutritional actions related to the maternal nutrition. Maternal nutrition is a very important issues in this lecture. Pregnant and breastfed women need an extra food, for example, iron. Pregnant women need at least one additional meals, 200 kilocalories per day. Pregnant woman needs to cut down her energy expenditures. So the strenuous household task and any exercise that lead to the higher energy expenditure should be reduced during the pregnancy. Pregnant women should at least eat iodized salt in their diet. Pregnant women should take a vitamin A rich foods such as mango, tomato, carrot, and green leaf vegetables and animal foods such as fish and liver. Pregnant women need a well-balanced diet containing a mixture of food. This should include as far as possible foods from a different food groups, animal products, fruits, vegetables, cereals, and legumes. Remember that there is no need for a high-priced foods. What is need and food with high quality rather than related to the price. Pregnant and lactating women can get an extra foods by eating a little more of ordinary meals. She should increase the amount of nourishment at 1 or 2 meals, not every meal. What about the important issues which is important in the nutrition of the pregnant woman? Folate is an essential because it is reduced risk of the baby being born with the spinal cord birth defects. It's called the neural tube defects. It is important to consume 400 microgram per day of folic acid before a pregnancy and 600 microgram per day during the pregnancy. Breastfeeding women need a 500 microgram per day. Foods such as broccoli, dark green vegetables, orange are high in folic acid. Now, what about the anemia during the pregnancy? How to prevent the anemia during the pregnancy? Anemia during the pregnancy is common problems linked to the mother's anemia include babies will be born without 3 to 6 month iron supply. Breast milk may have, why? Because the store of the fetal iron stores occur mainly in the last trimester. Breast milk have an insufficient iron but high bioavailability. Pregnant and breastfeeding mothers should have enough iron to keep herself and her baby healthy. She should eat plenty of iron rich foods every day such as dry beans, legumes, dark green leaf vegetable, liver, kidneys, and heart. Also, keep in our mind the iron store occur mainly in the last trimester. So the premature baby, it is liable for the early presentations of the iron deficiency anemia than the term baby. Pregnant women with a special need. A lot of the circumstances in which the pregnant women have a special need, special dietary regimen. Women from poor families who are employed. Women who are widows or separated, there is no social support. Mothers who have given birth to too many babies over in a short time. Women who are ill from a disease, for example, active TB. Women who look thin and depressed. Mothers whose previous babies were small and malnourished. Teenage mothers is very important. Women with a history of their baby or babies dying in their first year of life. Mothers overburdened with work. and mothers who are very worried, particularly in the first time pregnancy. All these circumstances, they need a special need for our special dietary. Now, there's questions. What are the effect of the low maternal iron level for the baby and mother in the pregnancy? The answer: the mother will have a difficulty during a childbirth and pregnancy. The baby of anemic mothers will not develop well and will have a low birth weight. The baby will then be easily affected by different kinds of infections. Another questions: which part of the body should examine to find out whether a pregnant woman is anemic or not? You should examine the lower eyelids, inside of the lips, and the palm of the hands. If there is anemic, they will be pale and whitish. If there is no anemic, they will be pink. Now, what about the nutritional regimen during the lactations? Breastfeeding. All babies are to be healthy and grow well. They must be fed breast milk. Breast milk is a food produced by the mother's body, especially for the baby, and it contains all the nutrients a healthy baby needs. A lactating woman needs at least 2 extra meals, 550 kilocalories of the whatever is available at home. That means an increase 20-25% over the usual intake before the pregnancy. Also, lactating women need a vitamin A, 200,000 international unit of vitamin A, which is given before delivery and 6 weeks later after. This will enable the baby to get an adequate supply of vitamin A for the first 6 months of life. During the first 6 months of the best way for feeding of the baby is for the mothers to breastfeed exclusively. So the WHO and the UNICEF recommend exclusively breastfeeding during the first 6 months. Also, lactating women need a lot of vitamin A, C, E, all B, and sodium. Apply only for individual under the 18 years. In addition to the extra meals, we should encourage about the iodized salt in her diet, at least 1 liter of water per day, vitamin A rich in foods, and you have learned that pregnant and lactating women require to be healthy and well for themselves and for their babies. So the nutrition's achievement, it is very effective for the mothers and for their. Now we are going to another important subject regarding the nutritional requirement in infancy and childhood and adolescence. The common features of infancy and childhood and adolescence is that all these age groups are undergoing rapid growth and development. Demand on their nutritional requirement. Small children and infants do not have a well-developed body nutrient stores and therefore are more vulnerable to infections. So the risk of infections increase in a malnourished child. In addition, they have a large surface area compared to their body size. All these factors increase their basal metabolic rate (BMR), resulting in increased risk of requirement of nutrition. Adolescent growth spurt. What about the adolescent growth spurt? Adolescents also undergo a very rapid growth during their puberty. It's called the pubertal growth spurt. The growth rate is very high right after birth. During infancy is very high after birth and during the infancy. Then the growth rate slows down until the age of 12 to 14 years. About 15 to 16 years, the pubertal period, there is a much rise in the growth rate and velocity. After that, the growth rate slows down again. So, the requirement for macronutrient, for example, protein, carbohydrate, and fats, and micronutrient are higher on per kilogram basis during the infancy and childhood than at any other developmental age. These needs are influenced by the rapid cell divisions occurring during the growth, which is required the protein, energy, and fat. An increased needs for these nutrients are reflected in a daily requirements for these age groups. An increased need for the nutrient. For example, energy. While most adults require 25 to 30 kilocalories per kg, 4 kilogram, infant require more than 100 kilocalories per kg. That's all 430 kilocalories per day. Infant of 4 to 6 months who weigh 6 kilogram require roughly 82 kilogram per kg. That's all 490 kilocalories per day. Energy needs remain high through the early formative years. Children of 1 to 3 years require approximately 83 kilocalories per kg, approaching 990 calories per day. So there is a difference in the requirement of energy is according to the age group. Energy requirement decline thereafter and are based on the weight and height and physical activity. As an energy sources, breast milk offer a significant advantage over a manufactured formula milk. So the breastfeeding associated with is a very important point. Keep in our mind, the breastfeed is very important because it's associated with a reduced risk of obesity, wide range of allergies, hypertension, type 1 diabetes, mellitus. Also, there is a link between the breastfeeding and improving cognitive development and with a decreased incidence and severity of infection. And also, it is less costly than the formula. This figure showing the constituent of the mother's milk, breast milk. Majority of the mother's milk, about 88%, is from waters, is followed by the lactose 7%, fat 3.8%, protein 0.9%, and 0.2% for others. Higher intake of protein and energy for the growth are recommended for adolescent. For most, a micronutrient recommendation looks like the adult. Exceptions are made for a certain minerals needed for a bone growth, for example calcium and phosphorus. Evidence is clear that bone calcium excretions increase as a result of exercise rather than from an increase in a calcium intake. Since weight gain often begins during the adolescent and a young adulthood, young people must establish healthy eating and lifestyle habit that reduce risk of chronic diseases later in life. So it's a very important nutritional issues when you get a balanced diet and balanced weight. Early life, it's a very important to make a state to reduce risk of chronic diseases. What about regarding waters? An infant and children need plenty of water to drink, particularly when ill or exposed to extreme temperatures. The total water requirement from beverage and foods are also higher in infant and children than for adults. Children have a larger body surface area per unit of body weight and reduced capacity for sweating when compared with the adult. Therefore, at a great risk of morbidity and mortality from dehydration. So the young child is liable for dehydrations and risk of morbidity and mortality from dehydration because of its larger surface area and reduce the capacity of sweating. So the parent may underestimate these fluid needs, especially if infant and children are experiencing fever and diarrhea or exposure of very cold or a very hot temperature. What about the essential fatty acid? Requirement for essential fatty acid or a fat on a per kilogram basis are higher in infant than the adult. All of us, we know the fatty acid, the rules of the fatty acid in the central nervous system, and it is membrane. However, infant and children should not ingest large amount of foods that contain predominantly fats. So it's important to get the balance right. So, in a brief, we will summarize what is mentioned in the beginning of the lectures. And the women need at least 2 mixed meals every day and some snacks. If they are pregnant or lactating, they need almost as much food as men, especially if they are also doing hard physical work. they need much more iron and folate than men, especially when they are pregnant. Adolescents need at least 2 large mixed meals and some snack each day. They can eat bulky foods. Boys need a lot of calories. Girls need plenty of iron. Pregnant adolescent girls are still growing, so they need more food than pregnant women. School-age children need at least 2 or 3 mixed meals and some snack each day. Children from 1 to 5 years old need breast milk until they are at least 2 years old. They need at least 3 mixed meals and 2 snacks each day. They cannot eat large or bulky meals. It is especially important for a meal to be clean and not to contain a parasite or a microorganism that could cause a diarrhea and other infections. Babies 6 to 12 months need a breast milk 8 to 10 times or more each day. They need small meals which are not bulky 3 to 5 times per day. Babies under 6 months old need an only breast milk, which is enough, at least 8 to 10 times each day. So, in this slide showing the recommended practices to improve the nutrition of the adolescent girls, 10 to 19 years, it is the age of reproductions. It's called the reproductive age or childbearing age girls. Recommended at all times. Increase food intake if they underweight to protect adolescent girls and women health and establish levels for the pregnancy and lactations. Diversity the diet to improve the quality and macronutrient intake. Increase daily consumptions of the fruit and vegetable. Use fortified foods such as vitamin A enriched sugars and other products of iron enriched and vitamin enriched flours and other staples when available. Use iodized salt. If the macronutrient requirement cannot be met through available food sources, supplements containing folic acid, iron, vitamin A, zinc, calcium, and other nutrients may be needed to build the stores and improve women's status. What about the rules of UNICEF? Rule of UNICEF make a guideline for the recommended during the period of special needs. During the adolescent and before a pregnancy, increase food intake to accommodate the adolescent growth spurt and to establish energy reserves for pregnancy and lactation. Delayed the first pregnancy to help ensure full growth and the nutritional stores. During the pregnancy, increase food intake to permit adequate weight gain and support the fetal growth and the future lactation. Take an iron folic acid tablet daily. During lactations, eat the equivalent of additional nutritional balance meal per day. An area where a vitamin deficiency is common, taking a high dose of vitamin A 200,000 international nutrition as after delivery as possible, but no later than 8 weeks postpartum to build the stores. Improve the vitamin A content of the breast milk and reduce infant and maternal. Now we talk about the self-assessment, which is will give a feedback about what is learned by these lectures. The first question: a pregnant woman ask your advice about what to eat because she is worried about having another low birth weight baby. What should you tell her? The typical answer when advising a pregnant woman what to eat, you would first tell her that is very important to gain weight during her pregnancy. All of us we know at least 11 kilogram. Then you need to advise her about eating food that contain vitamin A, iron and iodine, and making sure she has enough energy. She needs to eat well balanced diet, but there is no need for expensive additional food. Another questions, Mrs. tells X tells you she does not have enough milk. This is the usual excuse for all ladies in our society. For her baby, what questions you should need to want to ask before deciding how best to help her? If the mother tell you she doesn't have enough milk for her baby, you would want to ask her if she's eating enough, more than she did before becoming a mother, and if she is eating and a good mixtures of food, you would also want to ask her if she is drinking enough. Finally, you need to know if she is receiving a dose of vitamin A shortly after birth, and she is now eating a food containing a high amount of vitamin A. So it is not easily to prescribe formula feeding if there is this execution. Another question: children and elderly people both need a special nutritional care. However, they needs, it's a difference. What are the two of these differences? There are many differences between the nutritional needs for children and elderly people, but you might have chosen two of the following. Small children have a higher basal metabolic rate than older people, so need more nutrients. Children have a huge energy requirement, so need more calories than older people. Children need more water because they are at greater risk of dehydration. Older people might have a physical problem which make eating difficult. Older people need more vitamin D. Last questions in this lectures. A mother is worried because her adolescent son is eating too much. Adolescent son is eating so much. Is she right to be so worried? What are the reasons for your answer? The mother choose adolescent son is eating a lot does not need to worry unless he is eating a lot of one type of food. Adolescent experience a growth spurt at the age of 15-16 years, so need the large intake for all kinds of the nutrient during this time. And finally, thank you for your listening. Goodbye.